Hello, everyone. This lecture is about the medical nutrition therapy for gestational diabetes. I'm Shashadya Pattagama. In this lecture, we will be looking at the risk factors and consequences of gestational diabetes, or GDM, and we would be looking at the diagnosis of GDM using the cutoff values, and also we are looking at overt diabetes in pregnancy. So GDM is the hyperglycemia that is first recognized during the pregnancy. So this woman have not had diabetes when they were pre-pregnant, but however, when they were screened for screen for GDM during pregnancy, they were identified as having high blood glucose levels. And this GDM has consequences for both mother and the baby. So usually during pregnancy, the insulin resistance is high, and if the pancreas is not able to produce more insulin, then the hyperglycemia develops. So the maternal hyperglycemia, the high blood glucose in the maternal blood, is being transported to the fetus through the placenta, and that results in excess secretion of insulin in the fetus. And this insulin acts as a growth factor for the fetus, and that would result in larger babies, large for gestational age infants. And also, this GDM have long-term risks like type 2 diabetes, metabolic syndrome, and cardiovascular diseases in the mother. And so GDM is not just about high blood sugar during pregnancy. It has immediate consequences for the fetus, delivery risks for the mother, and long-term metabolic implications for both. So this picture shows the complications, both long-term and short-term, for both mother and the baby. So throughout these slides, I have taken information from different peer-reviewed articles or information from different organizations. So I have always provided the relevant link or the relevant reference at the end of the slide. So if you're further interested in reading more, you can always do so. And then we will now look at the risk factors for GDM development. Certain groups of mothers are having high risk for development of GDM. For example, if somebody had previous GDM during their previous pregnancy, or when they were pre-pregnant, or when they were pregnant, if they had high blood glucose levels, they're having a higher risk for GDM in this pregnancy. And also that depends on maternal age. And if the mother's pre-pregnancy BMI is high, when it comes to BMI, we always talk about the pre-pregnancy BMI. So if that is higher than 30, that would be a risk factor for the development of GDM. And also having a family history of diabetes would be a risk factor. And women of certain ethnicities are having high risk. And also the history of adverse pregnancy outcomes during the previous pregnancies, like having a higher birth weight or preterm birth, would increase the risk for GDM development. And also polycystic ovarian syndrome and some medications, multiple pregnancies, hypothyroidism, these would be risk factors for the GDM development. So talking about the diagnosis of gestational diabetes, so that is diagnosed. This is one way of diagnosis, and these cutoff values, different organizations have slightly different cutoff values, and these keep changing. So I have taken these values from the Australian Diabetes and Pregnancy Society, and these were the most recent values, but this can be updated time to time. So it's important that we keep an eye on them. So this one is based on oral glucose tolerance test. So oral glucose tolerance test involves the procedure, if you don't know. So that means that involves that they ask the mother to keep fasting for overnight, and then they are provided with a glucose solution, glucose drink. So in this case, that is 75 grams. So that drink has 75 grams of glucose. So the mother has to drink it And then the blood samples are taken, and that is blood glucose levels are checked at different intervals. So the first one is the fasting plasma glucose level. That is, once they keep fasting before drinking the glucose solution, the blood glucose is tested. And the second one is after having this glucose solution, after 1 hour, it is this one. And then again, after 2 hours, that is tested. And let us look at these values. So the fasting value, uh, if the fasting value is greater than 5.3, then that is diagnosed as gestational diabetes. So there's another value which is 6.9. I'll explain that in the next slide. But to understand, if this OGTT fasting value is less than 5.3, then that is safe. They don't have GDM. But if that value is above or equal to 5.3, yes, they're having GDM. And if that value exceeds 6.9, we don't just call it GDM, but that is severe than that. So let's come to that in the next slide. So when it comes to 1 hour plasma glucose value, that is 1 hour after having this glucose solution, if that value is equal to or greater than 10.6, then they are having GDM. And again, the 2 hour value, if this value is less than 9, they're safe. But if this value is equal to or greater than 9, then they're having gestational diabetes. And if this value exceeds 11, yes, that is greater than 9, but still, if it exceeds 11, that is more severe. Let's come to that in the next slide. So I hope this is clear. So to be diagnosed as GDM, one or more of the following criteria should be there. Even if it's just one fulfilled, then we have to categorize that as a GDM. So then there's another one which is called overt diabetes in pregnancy. So if you have seen the earlier one, in this slide actually, so these values are a bit lower than the values for normal people. So that means we keep a lower value, lower threshold value for GDM diagnosis. And when it comes to over diabetes, that means that is defined as, again, hypoglycemia that is recognized during pregnancy, but that meets the diagnostic criteria for diabetes in non-pregnant adults. So as I said before, the diagnostic thresholds for diabetes in non-pregnant adults, the threshold value is a bit higher. So that means we can allow the glucose levels to be a bit more high when it comes to non-pregnant adults, but we are having a lower value means strict values for GDM. So if, for example, these values are again based on the same test, oral glucose tolerance test. Suppose a pregnant woman undergoes the oral glucose tolerance test, and so before drinking the glucose solution, their fasting plasma glucose was above 7. Then we don't call it gestational diabetes, but we call it overt diabetes in pregnancy. That means that could be uh, due to because this woman was having high blood glucose levels or having type 2 diabetes before pregnancy, but she did not know that. So she came to know that only after being screened for GDM. So this value is much higher than the cutoff values for GDM. So fasting plasma glucose going above 7. For example, if we go back to the previous slide, for GDM diagnosis, if the fasting plasma glucose value above 5.3, then we call it GDM. But if it's above 7, so up to 6.9, we still keep calling it GDM. But if it exceeds 6.9, for example, like in this slide, if it is above 7, that's not GDM. We call it over diabetes in pregnancy. And that is the one that is meeting the diagnostic threshold for non-pregnant adults, and that is a bit more severe. Again, for 2-hour plasma glucose levels, that should be exceeding 11.1. And also we can screen that with HbA1c, which is above 6.5, which is the diagnostic criteria for diabetes in non-pregnant adults. So if the HbA1c value exceeds 6.5%, we can call it over diabetes in pregnancy. So I was talking about the oral glucose tolerance test, and there are other ways of measuring this one as well. So if you're more interested, you can go to this link and you can read further. But this is a screenshot taken from this particular paper. So you can do, I mean, the pregnant woman can do self-monitoring, and these are the suggested blood glucose values if they do self-monitoring at home, not the oral glucose tolerance test, but self-monitoring of blood glucose. And also, so this can be done in all trimesters, but after second trimester, they can also do HbA1c. So there are different other methods of measuring that as well. So now coming to screening of gestational diabetes. So this is the procedure that is provided by this organization. So according to that one, so the first antenatal visit is once the woman identifies that they are pregnant. This is the first visit. And if they don't have the risk factors were the ones that I've discussed in a previous slide. For example, if the pre-pregnancy BMI was higher, or people of certain ethnicities, or if the mother's age is high, those were the risk factors like we discussed before. So if somebody does not have risk factors, okay, let's keep them. But if somebody is having a risk factor, then in the first trimester, they can test for HbA1c. And if this HbA1c is above 6.5, above 6.5 is the threshold value for non-pregnant adults, then we know that would be, if this HbA1c is greater than 6.5, that would be over diabetes in pregnancy. So you don't have to do an oral glucose tolerance test further, but that's over diabetes in pregnancy. And there could be another group of people who are having the risk factors, but their HbA1c values are normal. And then then they are not having GDM. Or they could still have previous gestational diabetes mellitus. So then for those people, we do a second screening, which is before 20 weeks. That would ideally be 10 to 14 weeks. And we again can identify whether they have over diabetes in pregnancy or they have gestational diabetes at the early stages based on these cutoff values. And then there's another point, which is between 24 to 28 weeks. That is called the universal testing for gestational diabetes for every woman, for all pregnant women, whether they previously had diabetes or whether they have risk factors or not, irrespective of any condition. If they are pregnant, they should be screened for GDM with oral glucose tolerance test at 24 to 28 weeks. And we are using the same cutoff values to see if they are having gestational diabetes, or in worst case, over diabetes in pregnancy, or if they don't have GDM. So that is how we do screen for that. So that is the end of this presentation. Thank you.